So, I'm Dr. SHUBDHA DHERMADIKARI. I'm practicing as a diabetologist in my Shivalaya Heart and Diabetes Clinic in Kolhapur, and I'm practicing here since last 14 years.
How does Imeglimin fit into your regular practice with the current landscape of T2DM treatment options? Kindly share your experience.
Since I'm practicing as a diabetologist, my every patient is diabetic, and I'm using all sorts of medications, all types of available medicines on diabetes management, and various basic drugs or the drugs which we are using traditionally. They have different mechanism of actions. So depending upon the patient's age, his lifestyle, his comorbid conditions, his metabolic status, we decide upon which medicines can be given to that particular patient. So that way we decide, and recently we are introducing this Imeglimin, a molecule that has totally different mechanism of action other than those which we are using traditionally, and it is showing quite good results, as its mechanism of action is basically on the mitochondrial functions, so which is not seen in any other drugs that are available and that we are using in our armamentarium.
In what specific patient populations do you see the greatest benefit of using Imeglimin?
So actually diabetic patients, if they are having some metabolic disturbances, usually they all have some or the other type of metabolic problems. If they are very much uncontrolled diabetic, they are having other comorbid conditions, and if they are having diabetic complications, or they are at high risk of developing high risk of developing complications in the recent future, in such patients we can use Imeglimin, and it has shown quite good results. It has shown to reduce the blood sugar levels to quite bringing down to them to the normal levels, and without going into the hypoglycemia. So that is another important thing which is required in the management, not only the control of the blood glucose, but we have to also see that the patient do not face the problems of hypoglycemia.
How does Imeglimin compare to other hypoglycemic agents in terms of safety and efficacy? Kindly share any real world case if you have.
Okay, so safety wise, obviously we are supposed to look into the safety of any medicines which we are giving in case of diabetic patients, because diabetes is a lifetime disease, and in such cases we have to continue the medicines which are lifetime. So molecules should be such that it should be efficacious, and at the same time it should be safe. It should not be causing, it itself should not add into the problem which the patient is already facing. So in my experience now, I've been using this Imeglimin for some time, and it is quite safe. And the problems that we see usually in other oral medications, like in case of sulfonylureas, we see hypoglycemia, or some cases there is weight gain, or in some cases they have some cardiac complications. They may have some cardiac complications, or sometimes they may affect the renal functions. So these types of complications or these type of risk things are not seen with Imeglimin. And efficacy wise, we can say that if we are seeing that the blood sugar control is not achieved by our traditional medicines, and we are adding Imeglimin into these patients, over a period of time it is seen that sometimes we may have to reduce the doses of insulin if the patient is on insulin, or sometimes it is also seen that we may have to reduce the dose of other medicines which the patient is taking. So in that way it is quite good.
In recent time, Imeglimin sustained release formulation with Indian study has been launched in India. What is your opinion on that?
So earlier it was a instant release formulation, and we had to give it twice a day, and the efficacy, its effect is also seen only when it is given 2 times a day. So and once it is given instant release in that formulation, sometimes the patient, in any case, in any medicines for that matter, instant release may have some GI disturbances, and such GI disturbances are not seen with the sustained release formulation, because the drug is released gradually over the period of time, and so in that way the GI side effects are not seen. It is very well tolerated, and efficacy is also good. So sometimes even like patient is on metformin, the patient is having some GI disturbances, so in such cases we may have to stop the molecule. But here if it is a sustained release formulation, sometimes the dose of other molecule, like as I said, metformin, if the patient is taking twice a day 1 gram metformin, and if we are introducing imeglimin, we may have to reduce the dose of metformin, which will definitely help the patient in giving him GI comfort.
How does the mitochondrial targeting mechanism of imeglimin influence its clinical use?
Actually, mitochondrial function, this is important in cellular, you can say, energy production. So it is the energy house of any particular cell, and it is also essential for the metabolic functions or metabolic regulations. Now what happens in diabetes is this mitochondrial dysfunction is seen, and thereby there is a metabolic dysregulation that is seen in the diabetes, and this leads to insulin resistance, or there is decrease. That means there is decrease in the insulin sensitivity. There is sometimes decrease in the insulin secretion. So all these things are seen. There is increase in the hepatic neoglucogenesis, and such things are seen because of mitochondrial dysfunction. When we are giving imeglimin, it will target this mitochondrial dysfunction, and it will try to help by improving the insulin sensitivity, decreasing the insulin resistance, by improving the insulin secretions, and also improving the metabolic functions of the individual. So it will directly target upon this mitochondrial function.
What are the key safety and efficacy findings from clinical evidences on imeglimin that clinicians should be aware of?
So when it is regarding the safety, it is we have to look into the GI side effects. And as I said, when we are giving a sustained release formulation, the GI side effects are further, already they are less. And when we are giving it instant, instead of instant release, we are giving a sustained release formulation, they are still further less. And it is tolerable, so no much side effects as far as I have been seeing. I have not seen significant side effects due to which I may have to stop the molecule. And blood control, sugar control is achieved within a short period of time. Other molecules I've seen we have to reduce the doses of other molecules, and thereby we can definitely try to delay the complications of related to diabetes due to achieving good HbA1c control.
Do you believe that imeglimin has the potential to change the future landscape of diabetes treatment?
Yeah, because till now what we are using is the traditional drugs, and they have their fix. We know what the mechanism of action of that current medicines, and now that we are still studying, we know this mechanism of action of this imeglimin, and we are using more and more this molecule on more and more patients, and it is seen that it improves the mitochondrial function of patients, and thereby it will reduce the diabetic complications. So if such is the mechanism of this particular molecule, dealing directly to the, or targeting directly to the mitochondrial function and protecting the patient from the complication, definitely it can become an important. Right now we are using it as an add-on with other molecules, yeah, but I think we can use it can become as a important cornerstone in the management of diabetes in the near future.
Any other key point or take-home message apart from that you would like to give?
See, this is as far as what I am seeing, this is a relatively new molecule, and we have to use it on more number of patients. We have to study the effects, side effects. Right now, it's a small group of patients which I am dealing with on this molecule. Just like how the traditional molecules of biguanides or sulfonylureas or SGLT2 inhibitors or DPP4 inhibitors, all these molecules, these have been using for a long, so many years, and thousands of patients are on those molecules, and various papers are presented on this. Uh, Hands-on experience on this molecule related to other molecules is little bit less, so it requires some more time and some more patience to study on, so that we can get still more information.